To understand the real cost of a failed batch, start at the microscopic level. One fractured compound, one disorganized active ingredient, and the run is compromised. In 2026, an out-of-specification error carries a $10 million price tag and at least a year of regulatory scrutiny. Many U.S. plants throw millions at black box AI and complex software overlays to stop these failures. The world's most efficient facilities take a simpler route. They rely on Kaizen, a 70-year-old Japanese philosophy of continuous improvement. It is the most reliable method for meeting the FDA's current quality management maturity standards. Over the next 6 minutes, we are going to outline a step-by-step guide to applying this to your floor. We will spot the waste, eliminate root causes of human error, and accelerate your batch release times. Surviving modern pharmaceutical regulations depends on your problem-solving mindset, not the size of your budget. Let's look at the first step. Step away from the boardroom analytics. Go to the actual production floor and observe. That physical space is where your money is made or lost. When you get there, look for Mura. That is the Japanese term for waste, and it is the hidden profit killer in U.S. manufacturing facilities. Look closely at this lab environment. The cramped desks, stacks of pending paperwork, and chaotic glassware arrangements are immediate physical bottlenecks. In a typical facility, Mura appears in 3 main forms: waiting, like analysts stalled out looking for signatures; motion, staff walking across a 50,000 square foot facility just to get a reference standard; and overprocessing, generating a 12-page report when the regulator only needs 2 pages of data. The very first step in your action plan is conducting a Gemba walk. You must walk your facility specifically to locate and document these non-value-adding tasks. High-level analytics are secondary to the physical flow of work. Your actual profit margins are decided on the shop floor. Once you map the floor, you will find deviation reports. The standard industry reflex is to blame human error and mandate retraining, but retraining rarely stops the mistake from happening again. Instead of blaming the operator, lean facilities use Poka-Yoke, the concept of physical error proofing. You design the process so the mistake is physically impossible to make. This side-by-side diagram shows the difference. The left relies on operator memory. The right uses Poka-Yoke color matching and interlocking shapes. A digital interlock halts incorrect batches. The results? Deviations dropped 70% in 6 months. FDA auditors look for this maturity culture, systems designed to make errors impossible, rather than cultures that punish inevitable human mistakes. Now that we've error-proofed the equipment, we have to fix the materials flow. Lab reagent stockouts stall batch release times and create unnecessary panic. The exact solution to this is a Kanban system. It is a visual signaling method that triggers a reorder precisely before your supplies run dry. The schematic shows a 2-GIN system. The active bin is used daily. When empty, it signals an automatic reorder, while operations use the reserve bin. This method cut release lead times from 15 days to 4, adding 11 days of shelf life to every batch. Systematizing the physical flow of reagents translates directly into improved cash flow and extended product viability. The 2026 job market prioritizes active problem solvers over those who only follow an SOP. Leading a Kaizen event, even a small one to optimize a reagent bin, proves you understand the business of science. You are protecting the patient and the P&L at the same time. This specific skill set is the primary differentiator for promotion from an assistant manager to a director-level role. What is the single most wasteful process you plan to target on your next Gemba walk? Let me know in the comments below. Hit the subscribe button for more operational insights, and check the description to download our continuous improvement checklist. Stop fighting the same daily fires, build resilient systems, and lead the way in pharmaceutical excellence.